Hello, my name is Carrie Clark. My pronouns are she, her, and I am the Regional Council Manager for Birth to 5 Illinois Region 48, covering Peoria County. Thank you for watching Region 48's Early Childhood Regional Needs Assessment Virtual Report. This recorded session will provide an overview of findings from the Birth to 5 Illinois Region 48 Needs Assessment, as well as talk about the strengths, needs, and recommendations for improving access to and enrollment in early childhood education and care programs in the region. A link to the full report can be found in the description below. If you would like to turn on closed captioning, click the CC icon at the bottom of the video. This will turn on the captions. If you want a language different than English, click on the gear icon for settings, click on subtitles, then auto translate, and you can scroll down to pick the language you want. In 2021, the Illinois Commission on Equitable Early Childhood Education and Care Funding issued a report with findings that highlighted the inequities in early childhood funding in Illinois and the need to create a better statewide infrastructure to support early childhood professionals, expand services and programs for families and caregivers, and increase enrollment in ECEC programs. The report focused on the importance of addressing racial inequities and the need to include local voices in the conversation funders and decision makers were having about early childhood education and care. To provide a structure for communities, families, and caregivers to engage with the data and share their experiences, a new statewide infrastructure was created across 39 regions, all of which align with existing Illinois State Board of Education regional offices of education boundaries but operate independently. Birth to 5 Illinois regional boundaries align with school districts instead of strictly following county lines, which can be a challenge for gathering and interpreting data because many early childhood services are provided by or tied to school districts. Region 48 includes Peoria County and is located in the northwest central part of the state. The Illinois River borders the entire eastern boundary of the region. It is the traditional home to the Peoria, Sauk and Fox, Potawatomi, Miami, Sioux, Kaskaskia, and Kickapoo tribes. Region 48 includes urban, suburban, and rural areas. The city of Peoria is located in the region. Joining me in the Region 48 office is Melissa Green, our Family and Community Engagement Specialist, and our Administrative Support, Rian Harrison.
I am Rian Harrison, and my pronouns are she, her. The experiences and knowledge families, caregivers, and early childhood professionals gain while navigating the complexities of the state's early childhood education and care system are valuable, and understanding their lived experience in the local context is vital for decision makers to ensure communities have access to the programs, services, and supports they need. To this end, Birth to 5 Illinois was created to harness family and caregiver voices in early childhood education and care and serve as a bridge between the communities and policymakers so family, caregiver, and professional experiences can guide the decisions made to expand or enhance services across the state. Our mission is to create a statewide regional infrastructure that will amplify input from communities in the development of policies and funding priorities. We support the mobilization of communities to build and sustain equitable access to inclusive, high-quality early childhood services for all children and families in the state of Illinois. We envision that our work will help all stakeholders reimagine a more equitable early childhood education and care system that respects family and community voice and works to ensure it is centered and prioritized at every level of decision making in Illinois. We have three main values and goals. First, we must prioritize family voice. Through this transformation centered on authentic family and community engagement, we will address the inequitable distribution of resources and services and rebuild our state's early childhood education and care system. Second, we must address the racial inequities that exist in our early childhood system. In an effort to move our early childhood education and care system to one where racism no longer impacts a child's success, We will work to dismantle barriers that have limited access to high-quality services for minoritized children in every corner of our state. Third, we will use the collective impact model to shift our current early childhood system to influence policy and funding at the local, regional, and state level. Birth to Five Illinois will use community-driven feedback to build a system that harnesses knowledge directly from families and providers and encourages decision makers to ensure new and/or expanded services are created to meet community needs.
I am Melissa Green, and my pronouns are she, her. Two critical parts of the new statewide infrastructure are family councils and action councils. Located in each of the 39 regions, the councils provide feedback on quantitative data from the Illinois Early Childhood Asset Map, or ICAM, and the Illinois Network of Child Care Resource Referral Agencies, or INCRA, to help contextualize the data at the local level. The councils meet twice a month in virtual, in-person, or hybrid meetings. The family councils are comprised of parents, caregivers from a wide variety of family types: single parents, adoptive and foster parents, caregivers of relatives, teen parents, two-parent families, multi-generational families, and more, and prioritize the voices of those who have not been involved in this type of work before. We want to highlight those who have been involved in our Region 48 Family Council over the past year and thank them for sharing their experiences with the early childhood system. Our Family Council members are Gary Craig, Megan Crookham, Anita Fry, Shelby Hall, Laurel Huston, Philonda James, Courtney Kilgore, Maribeth Larson, Kristen McGraw, Karishna Metz, Ciante Morris, Maricela Niato, Indiria Slaughter, Hunter Stahl, Timothy Whitaker Alverson, Katina White. Action councils are comprised of early childhood education and care professionals, healthcare providers, faith leaders, elected officials, and other community members. Each action council reserved 2 seats for parents or caregivers to ensure family voices were included in every discussion. Action Council members were invited to bring additional aggregated data on programs and services provided by their agency or organization to complement data from ICAM and INCRA. We extend thanks and gratitude to our Region 48 Action Council members: Katie Baumel, Kimberly Carey, Katie Cobb, Laura Kostick, Shannon Dalt, Kelly Gibler, Angela Green, Michael Murphy, Brenna Ryan, Andriana Simiriotis, Aaron Stout, Lisa Weaver, Jenna Wiesner.
Beyond the council meetings, additional qualitative data was collected community-wide through focus groups and interviews, and all council members were invited to provide input on each section of the Early Childhood Regional Needs Assessment. Council members developed the strengths, needs, and recommended next steps that are unique to each region. Regional teams, along with the support of their Action and Family Council members, created a dissemination plan and are holding community meetings virtually and in person to share their report's findings. The following slides highlight some data that was discussed by council members and provide insights into the early childhood education and care landscape in our region. Census data indicates there are just over 15,000 children under the age of 5 in Region 48. The children in the region are racially diverse, represented by 52% white, 25% African American, 9% that are 2 or more races, 8% Hispanic, and 6% Asian. However, the racial diversity primarily lies within the city of Peoria, and the rural areas of the region are much less racially diverse. Outside of the city of Peoria, the demographics are 73% white, 11% 2 or more races, 10% Asian, and small percentages of other races. Part of the conversation with council members were around priority populations defined by the Illinois Early Learning Council as groups that have been historically underserved by early childhood education and care programs. In Region 48, all priority populations are represented. Some examples include children living in families in poverty or deep poverty, children of teen parents, children experiencing homelessness, children with welfare involvement, children from families with low caregiver education attainment, and children being raised by a relative. While data on children and families from priority populations is limited, there are a few things of note about Region 48. According to the 2020 census, of the 15,000 children ages birth to 5 in the region, over 6,000 lived at or below 200% of the federal poverty level, meaning that many of them were eligible for a number of state-funded early childhood programs. Those living at the highest rates of poverty are concentrated in the city of Peoria. Additionally, the teen birth rate is nearly double that of the national rate. Region 48 is also home to 718 households that speak languages other than English. Additional information about priority populations was gathered through surveys, interviews, and focus groups, and is included throughout our final Early Childhood Regional Needs Assessment report. Community collaborations are an integral part of the early childhood landscape. Local early childhood community collaborations bring together community agencies, organizations, and individuals with a shared vision or goal. They understand the importance of improving early childhood education and care for children, caregivers, and providers. Region 48's local early childhood collaboration, the Early Childhood Forum, serves Peoria County as well as 2 neighboring counties outside of Region 48. The Early Childhood Forum formed in 1998 and meets monthly to discuss various topics such as funding, professional development, and outreach. The Early Childhood Forum includes members across several sectors, with representatives from child care programs, preschool for all, Head Start, home visiting, regional offices of education, school districts, higher education, the local child care resource and referral agency, health departments, social service agencies, park districts, and business representatives. Region 48 is also included in the Tri-County All Our Kids Early Childhood Network, also known as the Tri-County AOK Network. AOK networks are community-based collaborations that engage local agencies and stakeholders who care about the health and well-being of young children and their families. The Tri-County AOK Network is also a site for the Integrated Referral and Intake System, also known as IRIS, a web-based community referral system that helps organizations connect the families they serve to the right resources in their community. Since its pilot in the area, IRIS has grown to more than 50 partners across multiple sectors to support and connect families to resources. Finally, the Central Illinois Home Visiting Collaboration is comprised of agencies who provide home visiting services in the region. More information about the collaborations in Region 48 can be found in the Regional Needs Assessment. Region 48 is home to a variety of early childhood education and care programs and providers, all servicing children based on the licensing, funding, and staffing requirements. But access to early childhood programs and services is not equitable for all the region's families. Waitlists at child care centers within the region and the availability of child care in rural areas of our region are significant barriers for families and caregivers. Families and caregivers reported that they are reliant on grandparents or other family members to provide child care for their children. Some parents have had to quit their jobs or turn down career advancements due to the lack of available child care and cited the cost of care as a reason they haven't used it. There is a program that families can apply to through the Illinois Department of Human Services, or IDHS, called the Child Care Assistance Program, or CCAP. This program provides families with limited access to financial resources and access to quality, affordable child care while allowing caregivers to continue working and/or completing their education. All families are required to cost share on a sliding scale based on family size and income. However, not all providers will accept CCAP due to delayed payments, and not all families want to complete the application, which is lengthy and can be difficult to complete. There are publicly funded preschool options available in the region, such as Early Head Start, Preschool for All, and Preschool for All expansion programs. However, not all programs are full day, nor do all provide transportation to and from the program, leaving many families who qualify choosing not to enroll their children in a publicly funded program. Additionally, there are not enough spots for families to enroll their child in care across all programs in the region, leaving some families with very limited options for child care. Through community meetings, focus groups, interviews, and surveys, families in the region reiterated the urgent need for more affordable childcare and preschool options staffed with providers and teachers that are well paid, supported, and who will want to continue working in early childhood long term. Similar to other areas of the state, Region 48 is experiencing a staff and teacher shortage, preventing programs from operating at full capacity or expanding to meet community needs. Many community members report that low pay and a lack of benefits is a major factor when attracting and retaining workers in licensed childcare programs. The median yearly wage for a childcare occupation in the region is $26,000, less than half of the median household income in the region. Staff turnover is a big contributor to the workforce shortage, and it remains a concern among community members in Region 48. The pay is not a long-term option for many trying to support a family. Low pay combined with the demands of the position and long hours has left many staff burnt out and not willing to come back to the field. Other staff are leaving childcare programs to pursue positions with local school districts because they are able to offer higher pay and benefits. As a result of the workforce shortage, Region 48 has less slots available in both publicly funded and privately funded programs. Families all over the region have shared their stories about their experiences with the early childhood education and care system. One mother shared she was a certified public accountant and had to quit her job because she was unable to find childcare that fit her family's needs. She was unable to find care that was affordable, that didn't have a wait list, and could care for her children with special needs. Other parents and caregivers are working opposite shifts so they don't have to utilize childcare because it wasn't affordable for them to do so. Some parents and caregivers are utilizing a family member or friend for their childcare needs. This means if the family member or friend is not available to provide childcare, parents and caregivers are unable to work outside the home or have to take time off work during times when a family member or friend is not available to care for their children. Others have been forced to patch together their child's care with some time covered by a friend, family member, and enrollment in a part-day program. Community and council members identified several strengths of the early childhood system in the region. For the sake of time, I will only share a few. One strength is that the Peoria area has public transportation available. This provides a means for urban families to reach programs and services. Another strength is that publicly funded programs are present in our region. This includes Head Start, Early Head Start, Preschool for All expansion, and home visiting. Finally, early childhood collaborations are present and strong, providing a network of partners who are working together to meet the needs of families in the region. Community and council members also identified challenges and opportunities for growth in the region. For the sake of time, I will only share a few. Affordable childcare is needed throughout the region. The early intervention waitlist must be addressed, and the region needs more childcare options for children with special needs. Based on community and council conversations, recommendations have been made on how early childhood education and care programs and services can be improved for families in the region. Recommendations will be presented to lawmakers, state agencies, local elected officials, and funders so they can better understand the needs of families in the region and share the recommendations with them so they can see how to best meet those needs. These are a few of the recommendations made, but more can be found in the Regional Needs Assessment. Recommendation 1. Expand eligibility criteria for the Child Care Assistance Program, also known as CCAP, to increase access to affordable child care. This would include providing a sliding scale for program tuition based on household income and family size with no cap. CCAP should provide a graduated increase in tuition costs over an extended period when household income increases or family structure changes. Finally, licensed child care center and family child care home participation in the CCAP program should be incentivized. Recommendation 2. Utilize alternative options to ease the early intervention, or EI, waitlist. Early intervention should refer families to home visiting services if the family wishes to receive support while they're waiting for services to begin. Suggested activities and resources should be provided to the family and child care provider, if applicable, based on the developmental needs requiring EI services. An apprenticeship program can be developed for new EI providers. Apprentices could provide therapies under the case supervision of a provider with an advanced degree. Finally, expanding the use of therapy assistants to provide therapy to children birth to age 3 under the case supervision of a provider with an advanced degree could help ease the wait list for services. Recommendation 3. Families who have children with special needs are seeking more options for childcare. We need to raise awareness of childcare programs that provide an inclusive environment for children with special needs. Specialized training opportunities should be provided for childcare staff based on the population they serve. Incentives should be provided to childcare programs that provide an inclusive environment for children with special needs and staff who take early childhood special education coursework. Finally, early childhood special education courses should be required at the associate degree level.
This summer, we will be out in the community talking to more families, providers, and stakeholders about their experiences with early childhood education and care, and we want to talk with you. We invite community members, families, and early childhood professionals to join the conversation by filling out a council interest form. Please go to www.birth25il.com/councils or click the link in the description to get involved. Interest forms will close later this summer and council meetings will fully resume in August.
We are proud to be a department of INCRA and are grateful for funding from the Illinois State Board of Education and the Illinois Department of Human Services.
I want to thank our state partners for their support and you for watching. We encourage you to stay in touch with us by visiting our regional page at www.birth25il.com/region 48, joining our Facebook group, or reaching out to me via email at kclark@birth25il.com. Links to our pages along with my email address are available in the description below. Thank you for your time, and we look forward to connecting with you soon.